Hello, everybody. Welcome back. It's been some time since we last see each other in the Mindful Hour, and I think the last time was in January, and now it's April. How time flies! And it's back again. So it's our turn for this month for the clinical psychology unit. So I understand that today it's a rainy evening. For those who are still stuck in jam, I hope that you're able to drive safe or even allow us to accompany you during your trip back home. Right, so if for those who don't recognize me or you have forgotten me, I'm Jefferson, one of the clinical psychologists from the National Cancer Society of Malaysia. So for today, we'll be starting with our next episode of the Mindful Hour. And joining us today would be our Honorable Associate Professor Dr. Mahathir Ahmad, who is a senior lecturer and also a clinical psychologist from University Kebangsaan Malaysia. So let's welcome Dr. Mahathir to the live as well. Right, okay, I think there are some technical difficulty. We're still waiting for Doctor, but it's okay. So, here we go. Hi, Dr.
Hi,
Mahathir.
hello Jefferson. How are
Hi,
you?
how have you been?
I've been doing well.
Right, okay, so Dr. Mahathir, I think your volume is slightly soft. If you can speak a little bit louder. Right.
Okay, sure. Is it better now?
Yes, it's much better now.
Okay. I have to
Okay,
pull a
right.
little
So
bit
welcome,
speaker.
Dr. Mahathir.
Hi,
So,
hello.
so if for those who don't really know, right, Dr. Mahathir is one of my lecturers when I was studying clinical psychology master's program, and today is such an honor to welcome back Dr. Mahathir to share his insights on self mastery, right? And I believe Dr. Mahathir has been involved in a lot of community projects and also doing research among people with cancer as well. So today it's a great honor to have him here to share his insight with us.
It is my pleasure to be here, Jefferson, and thank you very much for inviting me uh, to
Right,
this prestigious, I would say, webinar. Okay,
right,
so
right,
it's,
right, right,
it's
right.
first time for me to join National Cancer Society. Yeah.
Right. And today's topic must be something very interesting to talk about because since when I was studying in UKM, when Dr. Mahathir was my lecturer, right, so he talked about self mastery in one of the classes in health psychology. So until now, I still remember the things that he's taught me and the things I have been implementing to my clients as well. So today it's again to bring up that topic for the public to actually get to know how to actually practice emotional self-mastery, especially for cancer patients, right? Okay, so without further ado,
Yeah.
let's bring up our slides so we can start our webinar for today, right? Okay,
Sure.
so moving on. So the content for the hour for today is first we'll talk about emotions and their association with medical procedures, right? So medical procedures not involve only treatment, but also like the screening procedures. For example, taking CT scan, going for CT scan, MRI scans, and all. Okay, then later we'll touch base on what is self-mastery, how to gain self-mastery, and lastly, we'll give out some tips. How can a person practice self-mastery? Okay, right, moving on. So first things first, Dr. Mahathir, what are the medical procedures that we can actually think about when it comes to the field of oncology?
Okay, when it comes to the field of oncology,
Mm,
most of the medical procedure would consider to be a stressful medical procedure,
mm,
which is some of the medical procedure may induce
mm,
stress,
mm,
okay, due to the aversive nature of the procedure itself. It
mm,
could be painful, it could be something strange for the patient. So, like for example, go for CT scan,
mm,
MRI,
mm,
mammography, which
mm,
is those who do not need to undergo, I mean, those who do not have any things related to cancer, they don't need to undergo those procedure. So
mm,
this procedure is considered to be stressful for the patient, okay, which
mm,
needs some preparation.
yep. Especially that
Even,
when.
yeah, yeah, sometimes we can actually categorize this into two categories:
Mm,
procedure for the examination and also procedure for the treatment itself. Okay,
mm,
example that I gave it to you just now is actually a procedure for the examination, but for treatment itself, like for
mm,
example, chemotherapy and
mm,
radiotherapy, like for example, is considered to be aversive for the patient,
mm,
and it can also induce stress to the patient definitely.
mm. Yep, yep. Especially when those device for examination, for example, is a CT scan. For those who actually first go
Mm,
into that CT scan room, right, it can be quite overwhelming to see such a gigantic device, and
it
also
is
like how
indeed.
a mammogram can actually induce some pain for some people, especially when they are compressing the breast area. So this again, we would understand that it would induce some level of stress to people who have to undergo these procedures. Similar with chemotherapy, that we have heard about how painful or what the side effects that will accompany chemotherapy itself. So again, these are stressful procedures, right? So other than
It is.
stress, Dr. Madhav, what other emotions that would actually associate with these medical procedures?
There are some emotional reactions
Mm,
when patient need to undergo this medical procedure. Like for example, it could be just a normal fear, which
mm,
I mean, it is quite normal for an individual to have fear to undergo the procedure, or it can go to the extent of extreme fear, or we consider that as an anxiety. Okay.
mm,
Anxiety could be related to the procedure itself. So it
mm,
can be anticipatory anxiety. You fear of what to anticipate because this is considered to be a new experience for the patient. Yeah. So do
mm,
not know what to expect. So this considered to be anticipatory anxiety. So it
mm,
could also be anxiety related to the outcome of the procedure
mm,
because patient is waiting for the outcome. So it's going to go through the process of breaking bad news, perhaps.
mm,
Okay.
mm,
So whenever they undergo the procedure itself, so it's going to be news after that. So it's going to be, it could be just good news or bad news. Okay.
mm,
So the outcome of the examination itself is considered to induce anxiety as well.
mm,
Yeah,
mm,
like you emphasized just now on the procedure itself, so
mm,
it can also induce procedural anxiety. Okay, like
mm,
for example, noise that come out from the machine, from
mm,
a machine, like for example,
mm,
the
mm,
compression of breast. Okay,
mm,
when patient undergo mammography, okay, the pain that come together with the procedure itself
mm,
can also
mm,
induce anxiety as well. Okay,
mm, mm. Yep,
so,
yep. I
so
think this
yeah.
is this is what I think the trend that we call now is scan anxiety.
Scan anxiety, yeah, that's
Right, right, right. So the anxiety that relates to the scanning procedures.
yeah, right, yeah, right.
Mm,
It is
mm,
not,
mm,
yeah, like you said just now, the equipment itself.
mm,
Some people relate.
mm,
MRI scan with coffin because the tunnel that patient have to go through the tunnel, and then the
mm,
process itself, like jackhammering noise or something like that.
mm,
So
mm,
this can actually, I mean, for those patients who never familiar with the procedure, it can induce anxiety definitely.
mm, mm, mm. Yep.
Yeah, on top, yeah, on top of anxiety, so it could also have emotional reaction like feeling of alienation,
Mm, mm,
avoidance, like for example. So I mean, for patient who just newly been diagnosed as having cancer or perhaps
mm,
any kind of chronic illness, so
mm,
they have to kind of play a new role as a patient. Okay, they
mm,
have to undergo the procedure, they have to attend appointment, they have
mm,
to play role as a sick person, as a person with illness. Yeah,
mm,
also involve lifestyle adjustment. Okay, and
mm,
unusual thing that they never practice in life, so they may have to adopt this new lifestyle. Okay,
mm,
and I think based on my what we call it. Interview with the patient
mm,
who undergo the stressful medical procedure, the process of undergoing itself would also create the feeling of alienation. Like, for
mm,
example, being examined with a person you do not know. I mean, perhaps. opposite sex. Okay, perhaps you have
mm,
some taboo in terms of undress yourself, and it's related to dignity. So these are
mm.
all that induce the feeling of alienation as well.
Right, right, right. So all these are the factors that would actually just aggravates the level of stress. And then when the stress and anxiety is there, people might actually avoid going to all these procedures entirely out of fear. Mm, mm, mm,
Unpleasant, perhaps. Yeah.
mm. Right. Okay. So I think now we have get to know that these are the common emotions that we actually associate with these medical procedures, right? So we have been talking a lot about anxiety, and just now Dr. Madia has been telling anxiety what comes before and after. So I would like to just point out
Mm,
one of the significant thing that people have anxiety when it comes to medical procedures are maybe they don't have enough time to actually process their
mm,
emotions. For example, they just got diagnosed, and then normally people will actually rush to start with treatment, right? So they may
mm,
not have that time to actually process what is happening, and then so without that time, it would just aggravate the level of anxiety because they don't know what's going to happen if they actually
mm.
start the treatment. Mm,
Yeah, there is some pro and con with the temporal factor that you mentioned just
mm,
now. So
mm,
perhaps too short time can create or can evoke anxiety because they
mm,
are not prepared for that.
mm,
But if, let's say, if you left unattended, that
mm,
feeling, yeah, or
mm,
perhaps you say give some time for patient to process,
mm,
patient may have to deal with this never ending uncertainty. Okay, so they have to
mm,
wait. So I would say the time interval
mm,
shouldn't be too short or too long for a patient
mm,
to process. And then you know that the process of what we call it detecting cancer or any chronic illness, we cannot left patient for
mm.
so long because it's going to delay the process of the treatment as well.
Right, right. So we couldn't, the time interval between the news and the treatment shouldn't be too short, so that
Yeah.
you wouldn't have time to process, or it shouldn't be too long, where the person has to
Mm,
endure
mm.
that uncertainty. So it has to be somewhat balance in between.
Balance and also solution to deal with the fear, to
Mm,
deal with the
mm. Yep,
anxiety. So
yep,
I mean
yep.
that we can work on time. Yeah.
Yep. So speaking about fear, right? We have when it comes to the community and in among cancer patients or survivors, right? The peers would actually share personal stories of how these medical procedures. So, for example, one survivor have talked about how difficult the chemotherapy is or radiotherapy is, right? Would
Mhm.
this actually induce more fear to those who are about to start all these procedures?
Yeah. It is not fair to kind of like blame them for sharing
Mm,
their experience, but
oh,
the thing is actually when they keep talking about that thing in a negative way or kind of
mm,
like
mm,
emphasizing on the dark side of the treatment or procedure itself,
mm,
so it
mm,
can evoke fear to those patients who are waiting for the procedure itself.
mm,
Yeah,
mm.
so I mean, due to this issue,
Mm,
sometimes it can contribute to avoidance behavior as well.
mm, mm,
Okay, which is they dare not to face the challenges, they dare not to face the procedure itself.
mm, mm,
Okay, so this definitely going to contribute to the delay in
mm,
diagnosis and treatments. Yeah,
mm,
and
mm,
then the impact would be patient is going to be less cooperative and poor
mm,
adherence in terms of following the medical procedure,
mm, mm,
or perhaps if patients have too much avoidant behavior, so it's going to
mm,
contribute to unsuccessful medical procedure because less
mm,
cooperative. And
mm,
the effect after that, yeah, the
mm,
post-treatment or post-procedure itself, it can contribute to kind of like um, can contribute to the what we call prolongation of length of hospital stay, and the process of recovery is going to be delayed as well due to
mm,
this
mm.
avoidance. Yeah.
Yep, yep. So you can actually see how these emotions can actually affect the subsequent journey or the trajectory of
Mm.
cancer itself. Okay, so knowing all these things, how can we actually manage that. So one of it is to practice self-mastery. So Dr.
Mhm.
Mahathir, would you like to enlighten us what is self-mastery?
Self mastery, in short, yeah.
Mm,
So when we try to kind of like explore resources that we have, the
mm,
strength that we have in ourselves. Try
mm,
to bring out that resources into consciousness and try
mm,
to be aware of those. Okay, so self mastery also a kind of like the sense of empowerment,
mm,
the sense of control that you have.
mm,
Okay, so like for example, for a person who not familiar in doing the task, in completing the task, okay,
mm,
so after they manage to do that, practice that exercise in doing it,
mm,
so it's going to improve or strengthening their self mastery. So mean that ability to what we call empower, ability to conquer the fear, ability to
mm,
face the challenges. I would say.
Okay, so the keyword here is empowerment,
You're
right?
right.
Empowerment and also having a sense of control of the situation.
Yes.
Okay, so right, this is the how the concept. To add on to what Dr. Maria shared, the concept of self mastery comes in that's the saying that actually all individuals have their existing coping strategies, and
You're right.
what self mastery do is they help them to rediscover again their existing coping strategy, and that's where the empowerment comes in, right? So once people have started to discover again their existing coping, they will actually get a sense of empowerment, and later on be a sense of have a sense of control as well, because they know that they have all these strategies. So just that we have to bring them out to use in this situation, right? So these
Mhm.
three are the main concept of self mastery. First, we have to know that everyone has their own coping strategies. Next is to rediscover, bring them back to your consciousness, and later is to make use of these strategies.
You're right.
Hmm.
Okay. So, Jeff, on top of what we call coping strategy, self mastery would also be related to knowledge and skill, the existing
Hmm.
knowledge and skill
Hmm.
that
Yeah.
you have in order to
Mm,
face the challenges. Yeah.
mm, mm.
Mhm.
Right. Okay. So, Dr. Mahdi, if let's say this is the very first time, let's say a cancer patient who just got newly diagnosed, it's the first time they got to know about this disease, right? So how maybe this person does not have any existing coping strategies to this cancer. So how
Mhm.
what how would they say that they have existing coping strategies?
Existing because coping strategy it can come from many sources. So like
Mm,
for example, for a person who never know or know nothing about cancer, so like for example
mm,
breast
mm,
cancer, because when things doesn't related to you, so you
mm,
wouldn't do some homework and know more about that, right? So
mm,
what, but if let's say you have someone, the significant others of yours or you yourself having that or develop that disease, so you started to kind of like what we call improve or enhance your resources related to that. So, like I said just now, so I mean, it is impossible to say that the person doesn't know at all. So
mm,
perhaps have limited knowledge on that, but after
mm,
they have, or I mean, um, after the things become more relevant to them, so
mm,
they're going to kind of like learn more, explore
mm.
more in the form of
Right.
knowledge or skill. So, like for example, how to
Mm,
take care of themselves, how to retard the progression of cancer or something like that. So, I would
mm,
say the learning process, I mean, the self mastery would also be
mm,
related as well.
right, right. So in this case, can I say that the coping strategy is the ability to learn new things, ability to look for new resources in terms to deal with the current situation?
Yeah, right. Yeah, right. So I would say that
Mm,
self mastery is a acquired skill and knowledge. Okay. So I
mm,
mean, you're not born with a skill, right? So I mean,
mm,
going through the process of learning, habituation,
mm,
imitation. Yeah.
mm. Right, right, and that just add on to the concept of self mastery, which is to adjust or to modify the current coping mechanism to the situation that they are going through. right? So
Yeah,
with
right.
self mastery, right, how can self mastery benefit cancer patients or cancer survivors?
In terms of facing this medical procedure, isn't it?
Mm, mm,
Yeah. Okay. So, I mean, patient who kind of like try to enhance or develop or strengthening their self mastery, so
mm,
they may have to focus on their personal strength. So, mean that strength that they have, the resources, the existing resources that they have, in
mm,
order to enable them to have a better empowerment, okay,
mm,
enable them to have a better sense of control over the
mm,
situation, okay, and looking into self and what can individual do for themselves in terms of like
mm,
to cope with the stress, to cope with the illness that they have.
mm,
Yeah. So I would say that self mastery would also be related to the self efficacy, the
mm,
level of confidence. So, mean
mm,
that if you have higher self mastery,
mm,
definitely your confident level to face the challenges or obstacles
mm,
that related to illness is going to be higher as well.
mm, mm.
Mm.
Right, right. Okay, so that's again goes back to empowerment to the self, to person
Yeah,
itself,
right.
right? So self mastery will eventually leads to self efficacy, and with self
Mm.
efficacy, the person can actually effectively manage those emotions that associate with medical procedures, right?
Yeah, right.
And also, like just now, Dr. Madi have shared that self mastery is to develop a sense of control over the situation, because once we have these resources or knowledge, then we can actually take control of what is happening. And this
Yeah, right.
subsequently allows change, allow more room for personal autonomy or change. Mm,
Yeah.
mm,
And it also refers to how much you believe in yourself that you'll be able to overcome, that you'll be able to
mm,
accomplish the task that been
mm,
given to you. Because
mm,
for me, like playing role as a patient, it's a for you to accomplish, for you to
mm,
win.
mm,
Yeah. So, like, if you believe that you'll be able to control the situation, so mean
mm,
that your self-efficacy should be high. Okay, so
mm, mm.
it's strongly related to the self mastery that we mentioned earlier.
Right, right, right. The personal belief on the person's capability. Right.
Capability, right?
So that's the thing. What I like about self mastery, because it puts the focus back to the person's strength and their capability. So
Yeah, right.
self mastery always believe that person has the capability to deal with this adversity.
Mhm.
Mm. Okay, so now we have learned about the concept and how it could benefit. So how to actually gain self mastery, Dr. Mahathir?
How to gain self mastery. Okay, okay. So there are many ways to. I mean, not to say many ways. There are two ways for me
Mm,
to strengthening self mastery. So
mm,
one is actually try to induce the belief that you'll be able to accomplish the task. I mean,
mm,
the sense of achievement that you'll be able to do that. Okay, so
mm,
like for example, you have to undergo MRI. Okay,
mm,
you have to you have to have some belief that you'll be able to accomplish the task. Okay,
mm,
so how would you strengthening that? Okay, from a person who know nothing about the procedure, you may
mm,
have to do some homework. You may
mm,
have to kind of like watch YouTube. How's
mm,
the machine look like? How is the procedure going to be? What kind of sensation that you're going to face? Like for example,
mm,
so these are all is going to be strengthening your self mastery.
mm,
Yeah. So the other way would be not only the sense of achievement, but you should also instill belief that you'll be able to overcome the obstacle. Okay.
mm,
Because
mm,
in the previous study, when they did the study related to the self mastery, they
mm,
would compare two group of experimental group. Okay, so they
mm,
put patients into group. So one group observing the model could be able to undergo the medical procedure without any obstacles. So we call it like a success story. Okay,
mm,
and we have another group. that this patient, okay, undergo the same procedure, but with
Mm,
a lot of obstacle. And at the end of the
mm,
day, the patient managed to overcome this obstacle. So we'll see that the second model, the one that is able to overcome the obstacle, is going to be more successful in instilling the self mastery among the patient.
mm.
Yeah.
Right, right. Okay, so again goes back to the knowledge and also the belief. Right. So
Mhm.
again, I think these two are the main key takeaways for how to develop self-mastery is to first know the knowledge. So based on like Young's model of mastery, right? The first thing is to have certainty. And how to get
Mhm.
certainty is to gather as much knowledge of the situation.
You're
And with
right.
knowledge, the person can actually knows what to expect and how to better deal with it.
Mhm. Mhm.
And that will eventually help the person to change, which is to exercise control and also influencing the situation through the
All right.
the available knowledge, which can actually help them to do better decision making and also problem solving, which eventually leads to change.
Mhm.
Right? And later, once change has take place, the person can slowly start to accept what is going on. So one of the way to accept is to acknowledge that the event, so acknowledging that a cancer treatment is valid and it's normal. So acknowledging that emotions associated to these procedures are actually normal, and that would eventually leads us to growth, which is attaining new competencies and also increased sense of efficacy, which what have we have been talking about lah, efficacy as well. Hmm.
Yeah. Okay.
Right. So just now, Dr. Made have been talking about something about the belief, right? So this
Mhm.
relates very closely to Bandura's self-efficacy enhancement, which is in
Mhm.
column for verbal persuasion, whereby if the
Mhm.
person is able to persuade himself or herself that he has the capability to achieve this goal, then they would actually develop self-efficacy.
You're right.
Mm,
Because
mm,
verbal persuasion is one of the techniques that when we
mm.
try to introduce
Mm,
self-efficacy enhancement
mm,
technique to the patient, so
mm,
the verbal persuasion would be, it can be in a form of self-statement that the patient
mm,
used to kind of like calm themselves. Okay, so like
mm,
for example, saya boleh, I can do it. Okay, so I'm going to manage this or something like that. Or
mm,
perhaps it can come from uh, significant others and also caregivers as well.
mm,
Okay,
mm,
through the persuasion, you can do it. I know you can do it. You're brave enough to undergo this. Okay,
mm,
and do
mm,
not forget the medical professionals as well, a person who deal with the patient themselves. So need to know how to use the magic word, okay, under the verbal persuasion in
mm,
order to persuade patient to undergo the
mm,
process of medical procedure successfully.
mm, mm. Right. So just now it's interesting that you mentioned how caregivers or medical professionals can actually provide this verbal persuasion, right? So I would like to
Mhm.
I'm wondering, so what if this person who is undergoing these procedures, right? They're relying so much on the persuasion from others. So, and when the
Mhm.
caregivers couldn't say that you can do it, would they actually have the sense that they are not capable?
Yeah. So it is, I mean, whenever we use the techniques of verbal persuasion, so it need to
Mm,
be used at moderation, and it need to be relevant to the context as well. So like
mm,
you said just now, I mean, most of the medical procedure, whenever patient need to undergo the procedure itself, so they have to
mm,
be independent. So they have to undergo the procedure independently. So they, like for example, they cannot be in the room of having MRI together with the caregiver. So
mm,
in this case, perhaps the process of persuasion need to happen before. Okay,
mm, mm,
so, I mean, and then we have to also create some sense of autonomy to the patient as well, sense of
mm,
empowerment. So, we
mm,
have to use it at moderation. So, verbal
mm,
persuasion is good, but we cannot kind of like make the patient to be reliant on the verbal persuasion of caregivers so much because we know
mm.
that at the end of the day, they have to undergo that procedure alone. Yeah.
Right. I like how you bring it back to the person's personal autonomy. So other than
Mm.
rely on others' persuasion, they have to acknowledge that they have to take control of the situation instead of
You're right.
being 100% reliance on others.
You're right. I think
Mm,
I like to emphasize when you mentioned about the personal autonomy.
mm,
If you observe the most of the MRI machine nowadays, they
mm,
have the panic button, okay,
mm,
inside the machine itself.
mm,
So whenever patient feel like suffocated or cannot stand
mm,
the scanning process, they can just click the panic button in order to kind of like communicate with the radiographer, perhaps, in order to stop the
mm,
procedure. Okay, so in this case, the ability to hold that panic button would create the sense of empowerment and sense of
mm,
control to the patient. So it worked in a psychological way in order to instill the sense of control and empowerment whenever they are in the
mm.
stand.
Right. Of course, they shouldn't misuse that button, lah, right?
Yes, because you know that it costs quite a lot. So if they have to stop and have to come again for this cancer, it's going to be
Yep. So it should only be used during that when there's a panic.
yeah,
Mm.
right.
Okay, right. So before we move towards how to practice self-mastery and to introduce some cases, right, I'd like to really focus on modeling because I feel like modeling can be such
Mhm.
a powerful tool as well, especially when cancer survivors they have a group of in the community, so where they can model people. So would you like to elaborate more on modeling?
Yeah, I think modeling is also become a powerful self-efficacy enhancement
Mm,
tool as well. Okay,
mm,
which is I think we learn throughout our lifespan, isn't it? Okay,
mm,
through observational learning, we see how our parent
mm,
perform the task. We see other patient do
mm,
tasks. Okay, and we imitate them. Okay,
mm,
so I like whenever I go to PPUKM pharmacy, so I can see that on the screen they demonstrate how patients are supposed to inject themselves with
ah,
injection. Okay, so mean that it's kind of like educate the patient at the same time
mm,
through the
mm,
process of observational learning. Okay,
mm,
so yeah, I mean, sometimes it is not enough for us to just say that you do it like this. You're not supposed to press too hard. You're not supposed to do it on the left.
mm,
I mean, it's going to be easier if you be able to demonstrate it. Okay, through
mm,
the perhaps you can do some video footage on how
mm,
to yeah, how to what we call it, how to undergo the process. Because I still
mm,
remember one of the demonstration technique that I use
mm,
because for especially for those patients who are not
mm,
familiar with medical procedure. Okay,
mm,
so I introduce them to the machine itself, and
mm,
I also have kind of like model who kind of undergo kind. It's kind of like mock MRI. It is not a real MRI,
mm,
but we have the model to undergo that, and we
mm,
have opportunity for a patient who's going to undergo the MRI scan to
mm,
see the process. How is it going? How is the stages of the
mm,
preparation part? Okay, how
mm,
are they going to change to the hospital gown? And after that, they're going to lie on the MRI bed? And how's the
mm,
process of going through? Is it head first or feet
mm,
first?
mm.
Something like that, so
Right.
that later it doesn't come as a surprise for them. Okay,
Mm.
so
Yeah.
they know it beforehand. Okay, so
Mm,
that's what we call modeling. So modeling as well, it can go both ways. So it can go
mm,
to the what we call achieving or accomplishing tasks without obstacle, and
mm.
accomplishing tasks with obstacle. Yeah.
Right. So let's suggest that for every radiography department, all hospitals should have one TV screen to show how's the MRI going to happen. You know,
I
because
would.
we
I
also
would.
talk about right preparation, right? I think one of
Mhm.
the quite significant part of MRI is to insert the contrast. Because for me, I also get it's
Mm,
something new for me. I thought that I can just lie down on an MRI machine and just go through, but actually there's a few
mm,
preparation steps. So people should be
you're right.
educated on this in order to better prepare themselves and to know what to expect, lah, right? Like how Dr. Mara
You're
said, you
right.
don't get a shock, a surprise when you go
Mm,
for your MRI scan. Hmm.
mm,
Right, right. Okay, so these are some of the ways that we can actually increase our self mastery. Right, so let's quickly jump into one case that we can actually present to our audiences to actually know in a real life situation how to actually prepare, gain self mastery. Okay, so the first case, I mean, the case that we're going to talk about today is, for example, one of your surgeon has suggested surgery to remove part of your colon and attach a stoma bag. So given that this case that you are being diagnosed with colorectal cancer, so this surgeon has suggested surgery and to remove one part of your colon, which is the part of your organ, right? And later
mm.
on, you attach a stoma bag. So in this case, how would this person actually prepare themselves to gain self mastery?
Okay, so I would what we call it, put it or divide it into four stages. Okay,
Hmm.
so first, I mean, after the patient have already received this, I would consider it as a bad news. So
Hmm.
they have to undergo the surgery and remove a part of the body. Okay, and have to attach with something considered to be strange for
Hmm.
them. Okay, stoma bag. Okay, so first, I think patient to need to acknowledge and try to understand the procedure itself and
Hmm.
seek for the second opinions, perhaps. Okay,
Hmm.
so as I said just now, enhance the knowledge. Okay, to know more about that procedure. Okay, how is it going to be? What will be the side effect of wearing it? Something like that. Okay,
Hmm.
and after that, before the procedure itself, it would be good for patient to be able to learn how to relax, okay, through relaxation techniques, okay,
Hmm.
in order to prepare for the procedure itself. And also need to also be educated related to the post-surgery care as well. Okay, because I would say relaxation work best at pre and also post-surgical as well.
Hmm.
And at the third step, I would say this particular patient need to make adjustment to a new lifestyle in preparation for a post-surgery care. Okay, so
Hmm.
perhaps they have to kind of like rehearsal, I would say. Okay, how does it feel like to wear the stoma bag or something like that? Okay,
Hmm.
so how would they adjust to a new lifestyle? Okay, what can they do? What they cannot do after
Hmm.
wearing this device or something like that. So because it's going to involve lifestyle adjustment as well. So like for example, they've been living for like 40 over years, okay, without any stretching on their body. So
Hmm.
by having the stoma bag is considered to be residual. So they have to get rid of that. Okay.
Hmm.
And at the fourth stage, I would say they search for and make commitment to value living with cancer. Okay, so means that
Hmm.
they have to learn how to accept. Okay, yeah. So I mean, you would say like, oh, you can just say it easily. I know it is not easy for the patient
Hmm.
to accept because acceptance is considered to be the last step. Okay, so it
Hmm.
takes some time for you to overcome denial. Okay,
Hmm.
it takes some time for you to be able to acknowledge and play a role as a patient. Yeah,
Hmm. Right, right. So
yeah.
based on this case, I can see that self mastery doesn't just involve before a medical procedures, right? So you can see maybe point one and step two is how we can gain self mastery before the surgical procedure, and
Mm,
then stage three and stage four actually involve a sense of self mastery as well. So it
mm,
doesn't just stops. Okay, so after the procedure, you can say, okay, done. I don't have to practice self mastery already. So actually, it extends after the procedure. And
yeah.
I believe these four steps relate closely to the youngest model of mastery just now, where first we get
Mm,
certainty, later we make changes, acceptance, and later on, final, we have growth. So I can
yeah.
see this is how the trajectory of self mastery should be.
Mhm. And post surgery, perhaps, is going to facilitate the process of recovery. Okay,
Mm,
it's going to cut short the hospital stay, perhaps. Okay,
mm,
and it
mm,
can also improve the adherence behavior for the patient as
mm.
well.
Yep, yep. And I believe in this case, right, the procedure doesn't involve just the surgery itself. Changing of the stoma, but it's also considered as a procedure that a person has to learn how to do and
Yeah,
also keep
right.
self mastery on it.
Mhm.
Right. Okay, so I think this is an interesting case that we can see how one person learn to gain self mastery and how self mastery can help this person in the long way. Okay, so it actually has another case, but looking at the time, we are unable. I don't think we have the time to discuss on case two. So
Okay.
I think this case already give to gauge us how the self mastery work in the context of oncology cancer patients and. In its association to medical procedures, lah, right? So before we end, we just want to conclude here that self-mastery is not the absence of stress. It's not to say that when we gain self-mastery means that, oh, stress is no longer here. So I just need to get not more knowledge and then I don't have to go through the stress. No, it's self-mastery is an attempt to actually overcome stress in a more successful way. So instead of stressing out how to go through these medical procedures, what you can do is learn self mastery and overcome it in a more effective way. So we have to remember self mastery is not the absence of stress, right? Okay,
Mhm.
so I think that concludes our webinar for today about self-mastery and medical procedures. So again, is I'm very happy to be able to touch on this topic again, Dr. Mahathir. It's something that again I really want to share to people, and I can see how I would say how beautiful self-mastery actually works for people
Mhm.
going through so much of struggles, and the things that they couldn't control. But what they can control is their own emotions and how are they able to prepare for all these medical procedures, right?
Yeah, right. Yeah, right. It is my pleasure as well to be able to share with the audience, to be able to share with the viewers related to
Mm,
this, because I think it would be useful information for the
mm,
patients and also audience. Okay.
right. Okay. So now I believe there are a few questions from our audience, so maybe we can take some time to answer some questions.
Sure.
Right. Let's hope that. Okay. So there's one question come from. I'm sorry if I pronounce it wrongly. Beyond, is it? Okay, so may I know if we are stressed most of the time, would it increase the risk of getting cancer? Hmm.
Okay,
Hmm.
okay. So Yvonne, isn't it? Okay. So Yvonne, there is no study show the direct effect of stress on cancer. So we cannot say that stress is a causal effect to contribute to cancer. However, those who have already had cancer, okay, the stress factor is going to kind of like exacerbate or exaggerate the cancer spreading itself. So it could be due to the hormonal factor, it could be due to the immune factor, which is whenever you have a high stress hormone, it's going to suppress the
Hmm.
immune system. So mean that it's going to make the condition of cancer become worse, but it is not kind of a direct effect that stress can cause cancer. So therefore, the stress inoculation or stress management is important for cancer patients in order to control the fast growing of cancer cell, okay, or perhaps to be able to manage and cope better with their everyday living.
Yep, yep. And I think stress itself also may exacerbate the quality of life of cancer patients. So if let's say you got cancer, if putting the biological side aside, right,
Mm,
stress would actually just cause you um, to have more how do I say to have poorer management of
yeah,
these
right.
side effects or these emotions associated with cancer. So let's say
Mm,
if like, once you got diagnosed with cancer, you have to struggle to go through chemotherapy, and stress would just make you even more difficult, or the struggle of chemotherapy itself is even worse when the stress level is high.
Yeah, and I would say it would also be related because Yvonne did mention that stress most of the time. So mean that the prolongation of stress, so it can
Mm,
contribute to the exhaustion stage. So mean that
mm,
our body not be able to defend the or resist the
mm,
progression of cancer anymore. So therefore, it's
mm.
make the cancer become worse.
Yep. Okay, so I hope that we actually answered your question, Yvonne. So do we have another question? Right, okay, so another question. So can coping strategies be born and developed from scratch, or is it inherited in you? Such an interesting question, right, Dr. Made?
Yes, it is indeed. Okay.
Hmm.
Would you like to respond on that first, Jeff, or would you like
Okay.
me to?
Be born. I can't really I can't really justify that whether coping strategies can be
Okay.
born, but I believe there are a few
Uh-huh.
school of thoughts would actually justify that it can be inborn, right? Because looking at the
Mhm.
evolutionary theories of in psychology, right, some strategies can be actually inherited, but I always believe
Okay.
that most of our coping strategies can be something that we modeled from, right?
Okay.
We will see on
Okay.
how our parents actually cope with things, or how we see our peers cope with things, and then we actually learn from that. Or do you have
Mhm.
a different thought, Dr.
Yeah,
Made?
I would say both innate, okay, innate, and
Mm,
also through the learning process, through the developmental process as
mm,
well. Because some people they're being born like most resilient. Okay,
mm,
as you can see, the child temperament. Some kid is considered to be a difficult child. Some kid can be like a by child or very good child or something like that. So
mm,
that is
mm,
actually a temperament factor that whenever they grow up, so they become kind of like more resilient, be able to
mm,
kind of like overcome obstacle more. So this is going to shape a better coping strategy for them. But
mm,
I think most of the time, about 70%, we learn the
mm,
coping strategy through the process of learning habituation, observational learning, okay, and through experience as well. So I
mm,
would say
mm,
70% is actually the environmental and learning factor,
mm,
and the 30% is born with, or I would say, talent.
mm. Right,
Yeah.
right, right. Okay, so the answer for that is both. Mm.
Yeah.
Right. Okay. So I believe we have one last question from Hazi. Okay. How do I manage my mindset during a time of crisis from escalating, especially if I'm an overthinker? So I
Mhm.
believe is that you are overthinker. So during time of crisis, you actually overthink about what is happening, and it will just escalate more, right? So Dr.
Mhm.
Made, how do you think Hazi can actually help to manage himself?
Yeah. I strongly believe in the power of mind. So
Mm,
therefore, the appraisal. Okay, as you can see, yeah, if we refer to the coping model, the Lazarus stress model. So there are two ways of the two ways of coping. So the
mm,
secondary coping is emphasizing on the way you appraise the crisis. So mean that the same crisis being phrased in two different persons. So the
mm,
impact is going to be different. It's based on how you see that. Okay.
mm,
So I would say the mindset or the process of appraisal, the process of the perception, the process of you looking at the obstacle or what we call challenges. So how would you
mm,
take it? Okay, whether you take it as a challenge or you take it as a threat. Definitely,
mm,
if you take it as a threat, the impact is going to be more major. So the
mm,
crisis is going to be bigger. Okay, so and definitely it's going to escalate the process.
mm,
So, like you say, overthinker as an overthinker, I would say the process of retune your mind, or we call it
mm,
reappraisal, or rethink over it. Okay,
mm,
so if you use the approach of cognitive behavior therapy,
mm,
especially on the cognitive part, so we try to kind of like encourage patient to kind of like re-evaluate, re
mm,
okay, perceive it again, okay,
mm,
and try to testify. Is it real? danger that I'm facing, or just imaginary danger, or I try to scare myself with that. Okay, am I
Mm,
overthinking? So how do I validate whether I'm overthinking? Perhaps you can check with other person. Okay, things that I'm
mm,
fear of at the moment, would that be valid for me to
mm,
fear it? Okay, am I overthinking? Am I overreacting to that stimulus,
mm,
to that threat? Yeah.
mm,
So I would say the process of retuning your mind would be helpful in order to reduce the impact of what we call it, the way you perceive the
mm.
threat, yeah,
Yep, yep, yep.
or
And
crisis.
and for me, I always feel that overthinking is not always a bad thing, because
Mhm.
overthinking anxiety when in times of crisis, right? Anxiety is in fact a coping mechanism. Just that whether it's a maladaptive coping or it's an adaptive coping. So if this anxiety actually
Mm.
brings you more insights on how to deal with this crisis, then I would say it's an adaptive one. But if overthinking just goes down the loop, goes down the downward spiral of what's going to happen, and then it just gets more negative and negative, then I would say it's a maladaptive one. And that's where how Dr. Maria says we have to intervene on this so-called overthinking and negative mindset lah. Mm.
Okay,
Right. I was told that there's one more question from Carrie. Okay, so Carrie asked,
from
what
Carrie.
about self-awareness comes first before one can realize self-mastery or able to exercise capability within the patient if what they can control and has motivation to overcome stress? Okay, I believe
A bit
right, right.
lengthy. How to make it? Okay.
Right. Okay. I believe
Uh,
what Carrie would ask is that comes before. Okay. So I believe what if the person is unable to realize self mastery and
uh-huh.
they have to learn self awareness first. I believe in order to
Huh?
realize self mastery.
Yeah, I would agree with that. So mean that
Mm,
you acknowledge, or you have
mm,
self-awareness, what's your
mm,
strength, what is your
mm,
weaknesses,
mm,
so that you be able to learn the self-mastery, or you be able to compensate the part that you have weak at
mm,
with enhancing or strengthening the self-mastery. Okay,
mm,
and the part that you consider to be your strength. So this one can be used as a resources for you,
mm,
can be used as a resource. Yeah. What about the second part?
mm,
To exercise capability within patient, provide the control and has motivation to overcome stress. Didn't quite get it.
mm. Within the if what they can control and has motivation. I believe Carrie is trying to ask that if this person whether this person can control or have the motivation to overcome the stress. So I believe it's a question about self control, is it?
Mhm, mhm. There are two part of what we call um, there are two part of executive function here.
Mm, mm,
Okay, so the self-control is one part. The motivation is actually work on the other part,
mm,
which is more on your drive, whether you really want to kind of like overcome, whether you have intention to kind of like move forward or something like that. So that's related to motivation. But at the
mm,
end of the day, I think they should be combined in order to improve the self mastery. So mean that you improve the sense of
mm,
control
mm,
plus your need to overcome, your motivation or
mm.
drive to kind of like move forward.
Right, right. Okay, so I hope that we actually answers Carrie's question. So Dr. Mani, I know that that was the last question, but we actually our webinar is actually quite famous. We have two more questions, so maybe you can address these two more, and then we will
Two
close
more
up.
questions from
Yes, yes,
Nuratika.
yes.
Uh,
Naratika. Okay, so Naratika asks, what self care
what's up?
do you recommend for people who always has appointment visits to the hospital to cope with the stress?
Self-care do you recommend for people
Mm,
who always has appointment visit to the hospital to cope with
mm,
the stress? Okay, so I would
mm,
say self-care related to overcoming stress. Okay,
mm,
stress management, stress inoculation. Okay, so
mm,
like for example, learn how to relax. Okay, learn how to detach yourself,
mm,
learn how to manage your time. Okay,
mm,
so those kind of thing, because self-care can be interpreted in many forms. You do things that good for yourself, that good for your well-being is considered to be
mm,
self-care. Okay, so mean that you know that those people who go to the hospital, we say, to cope with the stress. So these people have stress related issues. So you
mm,
need to identify what contribute to the stress. Okay,
mm,
is it internal factor or is it external factor? So like for example,
mm,
chasing the deadline. Okay, internal
mm.
factor, you're dealing with your own dilemma or conflict or something like that. You need
Right.
to identify first. Okay,
Mm,
so those kind of strategy that I mentioned earlier, the self-care that related to enhancing lifestyle, okay, time
mm,
management, okay, detachment, take fast and relax. Okay, so that considered to be things that you should do. Okay, together with coming to get advice related to coping with stress to the hospital. Okay,
mm,
so I'm sure
mm.
that the person that you see, counselor or psychotherapist or clinical psychologist, would also assist you in terms of taking care of yourself. Yeah.
Yep, yep. I like how Dr. Made said we have to look at the factor that's actually causing you distress, because we can't
Mm.
just blindly do a lot of self-care that we and before we actually identify what's the root cause of all this stress.
Mm.
Okay, so no Artika, if you're interested, you can actually I can if you allow, let me link you to our previous webinar where we talk about developing your own personal self-care toolkit. So you can actually go to our Facebook page and also YouTube channel to actually look back on our previous webinar in January where we talk about how can you develop your own self-care toolkit, which can be quite beneficial in your case lah. Right? Okay, so Dr.
Mm.
Martin, let's go to the last final question.
Okay, we come to the last question.
Yes, yes.
Hello,
Okay.
good evening.
Hmm. Right, so this is Haranti, hopefully. Okay, a former student of Dr.
Tree.
Made. Wow.
Yeah. Oh, that's why yeah, yeah, it sounds familiar to me.
Wow. Okay. So,
Ah.
so she asked, what strategies or sources of support do we utilize to navigate the emotional hurdles of medical procedure?
Sources of support do we
Hmm.
utilize to navigate emotional hurdle of
Hmm.
medical procedures? So that
Hmm.
I think there are the which contact that you are talking about, because in our country I would say it's quite limited. Okay, because I'm sure that in National Cancer Society of Malaysia, in many hospitals they have leaflet related to procedure
Hmm.
itself. Yeah. So in terms of how detailed is that? So because some of the hospital they have it quite detailed in terms of technical explanation on that procedure itself.
Hmm.
Yeah, but some hospital they kind of like brief leaflet about that. So you
Hmm.
can find it from the hospital leaflet, especially
Hmm.
the one that related to cancer and the one that related to the medical procedure as well. Because I'm sure that if you go to the MRI department, so they have leaflet for you.
Hmm.
And in terms of like video or some footage or things like that, I think we are still have limited resources in that. So you may have to find it, I mean, on YouTube, okay, from overseas. And then I'm sure that in terms of like uh, resources from the what we call academic resources like journals,
Hmm.
things related. So whenever when you do the search, you can just type stressful medical
Hmm.
procedure, surgical preparation, those kind of keyword that can bring you to the resources as well. Okay,
Hmm.
and
Hmm.
do not forget, because most of the what we call like I'm sure that KKM, our Kementerian Kesihatan, or
Hmm.
MOH, they also have website, okay,
Hmm.
that educate patient on the medical procedure. Or if you
Hmm.
go to the overseas website, okay, the NHS, National Health service in the UK. They also have website that explaining about the medical procedure, like the
Mm,
typical medical procedure, like mammography, MRI, endoscopy, things like that. So it would be useful to share with the patient.
mm.
Okay?
Yep, yep. So it's also important to note that the information, since we can access to the wonderful world of internet, we have to be very careful at the same
Mm,
to look at the information that we get online, right? We have to really know that these information are valid and is justifiable. So
need to
just
filter as well, Jeff,
yes,
because
yes.
I'm sure that when we Google the things, I mean, we have, I mean, because people, it would be good because some people they just share from their perspective as a
Mm,
patient, okay?
mm,
So or testimony or something like that. You can just take it with a pinch of salt, okay? So it is
mm.
not like because it sometimes if the information is not quite valid, so it's going to scare you as well. Okay, so it need to be filtered. It need to be kind of
Mm,
like stratified. Okay.
Yep, yep. Okay, so Harantri, hope that Dr. Madi is able to bring you more insight
You
other than
can text me for further question, Helen.
right, right. Okay, so Dr. Madi, I think that wraps up our webinar for today. So for the audience, I would like to grab your attention to a disclaimer that whatever we shared today is based on the psychological perspective of things. So if you have any questions regarding the medical side, feel free to contact us to speak to our medical officers in NCSM so they can actually provide you more insights. Okay, so right, Dr. Madi, that's it. Wow.
Thank you again. Thank you again for having me,
No worries,
Jefferson.
no
And thank
worries.
you very much for your assistant, Khalid. She's been very helpful since since yesterday. We were working on the technical part. Thank you so much. Okay.
Yes, yes, yes. This is the first time we
Okay.
actually invited someone from UKM. Last time was one of the students, Umu, and now today our lecturer. Right, so hopefully we have
Okay.
more such collaboration together to share our insights, our knowledge.
That would be great. I look
Mhm.
forward for that.
Right.
Okay.
Okay, thank you,
Okay.
Dr. Madi, and thank you for everyone for joining us today. Have a good
Okay.
evening, have a good rest.
Bye.
See you again
Not too
next
late to
time.
say Selamat Hari Raya.
Yep, selamat hari raya for anyone who is celebrating.
Okay.
Right, thank you. Bye bye, everyone.
Okay. Bye now.